8-year-old Mr. Chirabo was diagnosed with a disability when she was 6 months old.
During the process of giving birth, I went through prolonged labor. There's negligence by the nurse who was taking care of me.
The past 8 years have been a journey of pain, sorrow, and grief for her and her mother, Mary Lutaya.
She's not like a normal child. Her feeding is not easy. Society looks at you differently. School, everything is expensive. She's in Pampers since day one, 8 years of Pampers. Her medicine is expensive because she takes a tablet of 2,000 every day, so if you're not a working mother.
But Chirabo is not the only one going through that life of misery. Shafiq Sewuma is an 18-year-old who lost his limbs after a polio attack a couple of years ago. His condition was made worse by a vaccination that went wrong, leaving him crippled. He now relies on an artificial leg to get around.
Those days I was using crutches, and I was using these wooden crutches. You know, you can maybe moving, you fell down, you might be like at school, people they will be laughing at you. You will be a story to them.
Although Shafiq and Minsa have gone through a rough patch, they are now seeing a light at the end of the tunnel, thanks to an Indian charity organization called Narayan Seva Sansthan. They were given free treatment at a medical camp at Mulago Hospital. The medics did corrective surgeries on children with disabilities and fitted them with artificial limbs.
Last year, we used the media, television and radio. We made announcements, and on one day we received 550 disabled old people and children. So last year we operated 27 children, but because the days were few, some remained. This was a continuation of the remaining children.
So certainly this is another step. Once we treat them, then they can walk on their own feet, and then they start looking for what next.
Mr. Chirabo has had 3 corrective surgeries on both her arms and legs, and she is optimistic of living a normal life again. The rise in accidents, especially by motorcycle taxis that are commonly referred to as border borders, has led to a sharp increase in the number of injuries, even fatalities. Mulago's senior consultant orthopedic surgeon Dr. Tito Bayaza has called on the government to increase funding to their department to carry out more surgeries.
So orthopedic surgeries are very expensive if they are done privately, and therefore I would appeal to government to raise the budget to meet the needs of the local person.